Did you know that your brain can't tell the difference between a life-saving prescription medication and an illegal drug? Both activate the same neural pathways that evolved millions of years ago to help our ancestors survive. This shocking reality explains why prescription drug addiction has become one of the fastest-growing health crises of our time. When you take a prescription opioid for pain, it doesn't just block your pain signals. These medications flood your brain's reward center with dopamine, the same chemical released when you eat your favorite food or fall in love. Your brain interprets this surge as a survival signal, telling you that this substance is necessary for life. Here's where the science gets fascinating and frightening. Within just 5 days of regular opioid use, your brain begins rewiring itself. Neurons start producing fewer natural dopamine receptors, creating what scientists call tolerance. Your brain literally changes its architecture to accommodate the drug, making everyday activities feel less rewarding without it. The numbers are staggering. Research shows that 1 in 4 patients who receive prescription opioids for chronic pain in primary care settings struggles with addiction. Even more surprising, studies reveal that genetic factors account for roughly 60% of addiction risk. This means some people are biologically predisposed to develop dependencies, often unaware. But opioids aren't the only culprits. Benzodiazepines, prescribed for anxiety and sleep disorders, work by enhancing a brain chemical called gamma-aminobutyric acid. While this calms your nervous system, it quickly creates physical dependence. Some patients experience withdrawal symptoms after just 2 weeks of regular use. The most counterintuitive aspect is that prescription addiction often begins with complete medical compliance. Patients following their doctor's exact instructions can unknowingly develop dependencies. When forming these powerful neural connections, the brain doesn't distinguish between medical necessity and recreational use. Modern neuroscience has revealed that addiction fundamentally alters 3 key brain regions. The prefrontal cortex, responsible for decision-making, becomes impaired. The limbic system processes emotions and memories, and becomes hyperactive around drug-related cues. Meanwhile, controlling basic survival functions, the brainstem begins treating the drug as essential as food or water. The most remarkable is how quickly these changes occur. Brain imaging studies show measurable alterations in neural activity after a single dose of certain medications. This explains why some patients report feeling different immediately, even when taking medications exactly as prescribed. Understanding this science doesn't diminish the importance of prescription medications. Instead, it highlights why medical supervision, gradual tapering, and addiction monitoring are crucial components of responsible prescribing. Your brain's ancient survival mechanisms, designed to keep you alive, can sometimes work against your modern medical needs.